I will present to you about the pulmonary disease. Pulmonary disease is a lung disease or anything that relates with respiratory system. Usually the lungs get infected is due to an external factor such as inhaling, secondhand smoking, and any form of polluted air environments. If you were to be exposed by these external factors, it can lead to many types of pulmonary diseases such as asthma, pneumonia, and even lung cancer. But emphysema and chronic bronchitis are the two most common conditions that occur in today's society. These two conditions usually occur together and can vary in severity among individuals. So, some individuals can be cured by just growing up, but you will be needing to do some exercises as you grow up. So you cannot just don't do anything and expect you to be cured. So for that you must strengthen your lung tissue to be more stronger and your VO2 max increased. So right now I'm going to pass the presentation to Jalal.
To Alfi for the slide. Assalamualaikum warahmatullahi wabarakatuh, and good morning to Madam Maisara and all my fellow friends. Today I will talk about the purpose of the exercise that can reduce the pulmonary disease. The World Health Organization (WHO) recommends that adults 18 years more mature and older exercise a minimum of 2 hours per week with moderate intensity or 1 hour per week with a serious or high intensity. Therefore, the square measure advantage that we are able to get from physical activity for patients. World Health Organization had pneumonic sickness. Exercise of moderate intensity, likewise as significant intensity, have a positive impact on the guts. It cannot solely improve blood circulation from the guts to the remainder of the body and scale back pressure level. However, it also can strengthen the gut muscle. In different respiratory organ disease like COPD or chronic obstructive pulmonary disease, aerobic is nice for your heart and lungs and permits us to use oxygen with efficiency. Walking, biking, swimming, and jogging are a nice sample of aerobic exercise. Try to do that variety of exercise for regarding an hour of time per week. Aerobic can also facilitate relief shortness of breath, improve sleep quality, and scale back to the requirement for admissions to a medical center. The patients will do that variety of exercise for regarding an hour a number of times per week. Next, the positive effects of exercise and body, it will improve practical ability and muscles, strength, reduce shortness of breath, and improve quality of our daily life and managing persistent aspect from reduce the danger of different health issues as well as polygenic disease, pathology, health issues, anxiety or depression, and also cancer. Stretching relax you and improve your flexibility. It is also an honest thanks to hit up before and funky down once exercise. Apply holding a mild stretch for 10 to 30 seconds, slowly inhaling and out. Repeat this a number of times. And lastly, I will talk about the resistance coaching. Resistance coaching, it will create all our muscles stronger. It always involves weights or resistance bands. However, we did not allow to go to the gymnasium during a pandemic. To be easier, we are able to calculate at our house. Raise the doctor or metabolism expert to point out some exercise. You will be able to do resection to induce stronger. Do the exercise 3 to 4 per week. That's only for me. Now I would like to pass the next slide to Nabila. Thank you.
Thank you to Jalal. So I will present about the physical and functional concern consideration. Pulmonary rehabilitation is a program that can help you to improve your quality of life by teaching you on how to breathe more easily. Breathing, retraining, exercise training, education and counseling are all elements of it. Regular exercise provides significant advantages. Workout and particularly aerobic exercise can enhance circulation and help the body consume oxygen more effectively. Aside from that, work on improving your chronic obstructive pulmonary disease, which is also known as COPD symptoms. Moreover, increase your energy level so you may participate in more activities without being fatigued or out of breath. The first exercise for the pulmonary rehabilitation is aerobic exercise, regular physical exercise that involve big muscle group. This sort of exercise enhances the body's ability to use oxygen by strengthening the heart and lungs. Because your heart doesn't have to work as hard during exercise, it can help lower your heart rate and blood pressure over time, as well as enhance your breathing. Aerobic exercise include activities such as walking, biking, and swimming. Try to do this form of workout a few times for a week, around half an hour. Other than that, the other exercise that's suitable for pulmonary rehabilitation is resistance training. All of your muscles, including the ones that help you breathe, become stronger as a result of resistance training. It usually involves the use of weight or resistance bands, although it does not require the use of a gym. Request that your doctor or respiratory therapist demonstrate some at-home exercise. Perform this workout 3 to 4 times each week to gain strength. So I will pass the slide to Myra.
Thank you, Nabila. First of all, I will introduce myself. My name is Siti Umairah binti Zulkifli. So I will explain about the psychological and emotional consideration. The physical difficulties of handling chronic obstructive pulmonary disease, which is COPD, can sometimes have an effect on a person's behavior and emotional well-being. Most of chronic obstructive pulmonary disease patients experience depression, anxiety, and decreased self-esteem from time to time. When dealing with this serious illness, this is common and normal issue. A depression is a mental illness that characterized by a persistent sense of depression and lack of interest. This is not same as the mood swing that everybody goes through on a daily routine. The depression will affect a patient of COPD daily routine, which is the ability to enjoy their work, their family, and all their friends. Depression is a serious illness that have effect beyond their mood. As example, the patient is always feeling down and it can be difficult to commit to the treatment plan. So because of this, it will be easy for the patients to forget to take a medicine or doing some of an exercise. Most of COPD patients have anxiety. Anxiety can be defined as a feeling of being anxious about something. Shortness of breath can trigger anxiety and even panic attack for people who have COPD. Anxiety causes you to breathe harder, which causes you to become short of breath. Worrying about preventing shortness of breath can cause you to become less effective, which can get worse of your health. As example, in patients with COPD who are over 17 years old who have had a 10 years disease path, 13 until 16 minutes workout session of wellness, qigong and yoga for 20 24 weeks had a positive impact on their anxiety. Next, decreased self-esteem issue are significant contribute to chronic obstructive pulmonary disease, which is COPD, because they can make the patient difficult to achieve goals and maintain a social life. As example, usually the patients might be low esteem if some of the exercise they cannot be able to do because they does not have any confidence at all. I think that's all from me. I will pass the next slide to Alfie.
Okay, thank you Myra for the explanation. Now I'm going to talk about the general exercise recommendation for people who have pulmonary diseases. People with pulmonary diseases can be devastating because they oftentimes when they try to exercise they have the shortness of breath, but they can take it slowly and gradually, increasing the intensity over time. So by exercising frequently, you can decrease the shortness of breath that you can get and control how you breathe. By exercising frequently too, you can improve the overall quality of life, and the ability for you to exercise becomes much more easier. Okay, you can start by having a chat with your doctor to see how much intensity of an exercise that you can do. You can know what level you are, either you can do very intense or you can start with moderate or beginner. Okay, from then on out you can pick which exercise is best for you. Okay, this is the FITT principle. Here are some examples of exercise that we recommend. First is calisthenics. Example of calisthenics is push-ups, sit-ups, pull-ups, and much more. These are the three most basic calisthenics exercises you can do. It is good because you don't need much equipment other than your own body weight. By doing calisthenics, it increases your muscle mass and toning your body, so it doesn't you have a look of too skinny. So besides that, walking around for 150 minutes of moderate intensity and jogging around 75 minutes of vigorous intensity can help your breathing control. It helps you heart rate up, warming up your body, making your muscle memory for how much oxygen when you run, how much oxygen you can take, and how much exhale you can do, exhale you produce. When you can learn how to control your breath, you don't have to inhale or exhale excessively as you were to not exercise. So when you exercise, you know how much oxygen you can breathe in and how much carbon dioxide you can release. So when you walk or jog, it increases your strength in your lung tissue, making them more healthier. Because of your muscular strength is improved, your muscle will be needing less oxygen to operate with a simple task. So it helps to reduce the stress of your lungs to make the oxygenated blood. So you don't have to keep on breathing consistently, more frequently. So you just control your breathing, and it helps you. So when you it is recommended for you to stretch your joint and your muscles for at least 10 to 30 seconds of hold of static stretching, because it helps to relieve your looseness and your tightness of your body, so that after you do an exercise or before you do an exercise and after you do an exercise, you will not get unnecessary injuries. So next, I will pass the presentation to Izatul.
Thank you, Alfie. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Izatul Bakis binti Omar Amir. I am from SL134B. So now I will proceed with 3 weeks training program for pulmonary disease. This training program will help the patient who have pulmonary disease improve their circulation and helps the body better use oxygen. It will also strengthen their heart and cardiovascular system. So for the first week, we will do Walking for day 1. Walking is a great choice especially for the person who is just getting started. It can be do anywhere, which is at the outside the house, in the mall, or on the treadmill. So for the next exercises, which is arm curl and forward arm raises, it is to focus on strength. It can improve our muscle tissues and improve their breathing. Like if they want to do their exercises, they have to exhale and inhale slowly so that they can improve their breathing, so they can breathe smoothly. So for the next exercise, we will focus on our leg muscle strength, and the exercises are calf raises and leg extension. These leg exercises are important to add in on our training program because it focuses on our leg. So this leg routine can be added in this training program to give our strength in our leg muscle so that they're able to walk easier and farther. So for the next exercise, we will focus on aerobic exercise, which is brisk walking. Brisk walking can improve the health of heart and lungs. It can also lower risk for many health conditions and help to manage weight. Additional, brisk walking can improve brain function. It can boost energy, reduce stress, and improve sleep. Next, we add on Pilates in this training program because Pilates is increase muscles strength and tone the muscles. Moreover, Pilates is a low intensity exercise, so people who have pulmonary disease can do it easily. So at day 3, we focus on aerobic exercise and strength exercise. For the strength exercise, we repeat from the day 1. For aerobic exercise, we add on jogging and jumping rope. Jogging and jumping rope is good for the person who have pulmonary disease because it improves cardiovascular conditioning, help to decrease risk of heart disease, and it improves the lung function. Last exercise that we include in this training program is Tai Chi. Why Tai Chi? It is because it is a mild workout for heart and lungs and helps to tone muscle, and it also eases stress and helps us to relax. So according to this training program that we have done, we put only 3 days for the first week and 4 days for week 2 and week 3. This is because we want the person to adapt this exercise. Then we continue for the progression. Then we increase the set and repetition at the week 2 and week 3. So in conclusion, exercise is important to all of us, especially for people who have pulmonary disease. It can help to improve our circulation and help put the better use of oxygen. It also can increase endurance and strengthen our heart and cardiovascular system. Moreover, it also can build energy levels so we can do more activities without feeling tired or short of breath. That's all from our group. Thank you.